The fluorescent lights hummed overhead at Seattle General, that endless mechanical droning that every trauma nurse learned to tune out by week 2. Katie Rodriguez was on week 34, and she still noticed it, the way the hum changed pitch under stress, climbing an octave when the ER pushed toward capacity. The smell hit first when you entered the unit, antiseptic layered over stale coffee, underneath it all the copper tang of blood and the sharper bite of ozone that lingered after the defibrillator paddles fired. She moved through it like water through water, invisible in her scrubs, her badge clipped to a pocket she'd reinforced twice because the hospital-issued ones always tore. 8 months she'd been here. 8 months of watching the hierarchy lock into place like steel rebar set in concrete. The trauma bay doors slid open with their pneumatic wheeze, and Dr. Marcus Ashford followed behind the attending physicians like a man who owned the space because he'd written the policies that governed it. He was tall, the kind of tall that made men smaller in his presence, with hands that had never done the work themselves, they'd only directed hands that did. Katie was checking the crash cart inventory, running her fingers along the surgical supplies, each item in its place because chaos lived in disorder and she'd learned long ago that disorder killed people. She didn't look up when he entered. Not yet. We've got a 52-year-old male, 3-vessel disease, presenting with crushing substernal chest pain, one of the residents was saying, his voice climbing at the edges the way residents' voices did when Ashford was in the room. Started at home, wife called 911, ETA was 8 minutes, he's been symptomatic for. The patient's medication history, Ashford cut in, and Katie heard the edge underneath his words, that particular sharpness he deployed like a scalpel to remind everyone exactly who held the knife. Did anyone actually review it before bringing him through those doors, or are we just guessing today? The resident's shoulders folded inward. Katie continued counting syringes, her movements methodical, each one placed in its designated slot. But her eyes had lifted now, scanning the monitor, reading the 12-lead EKG they'd just run. The strips printed out in real time, that jagged language of the heart translating itself across the paper. ST elevation in the anterior leads. Obvious. Textbook. But there was something else underneath it, a subtle pattern in the lateral deflection that most people missed because they were looking at the main event. She moved toward the bedside. Not quickly. Not in a way that drew attention. Just the natural progression of a competent nurse checking on a patient, verifying before access, confirming the monitor leads were reading clean. Ashford was already reviewing the chart, his fingers moving across the tablet with the theatrical precision of a man who needed everyone watching him think. 1 aspirin, 325 milligrams, he announced. Clopidogrel, 600 milligrams. Heparin drip, start at 80 units per kilogram. He paused, letting the words settle like pronouncements from above, before glancing at the resident. This is STEMI protocol. You do know STEMI protocol, I assume. Katie's hand stilled on the 4 line. The dosing was wrong, not catastrophically wrong, but wrong enough. The heparin calculation he'd just stated was approximately 18% above what the patient's weight supported, what his renal function could safely clear. She watched the resident nod, watched him reach for the medication drawer-up, watched the cascade begin. She turned toward Ashford, her voice steady as a nurse who was simply clarifying standard procedure. His weight is documented at 178 pounds. The heparin calculation at 80 units per kilogram would be approximately 6,500 units for the bolus. His creatinine is 1.3, which suggests we should consider renal clearance adjustment. She paused, let one breath move in and out. Recommend 60 units per kilogram. Approximately 4,872 units, instead. The room went still. That peculiar silence that happens when someone junior has just spoken to someone senior using words like recommend instead of could you maybe possibly consider. Ashford's head lifted from the tablet slowly, as if he was physically turning to face her, and his eyes carried the particular coldness of a man whose authority had just been questioned in front of witnesses. I'm sorry, he said, and the politeness in his voice made it so much worse, because it was the politeness of someone about to destroy you. Are you a cardiologist, Nurse Rodriguez? No, sir. She met his eyes. One measured breath. Her hand stayed still against the bedside rail. Are you a physician at all? "No, sir." "Then perhaps," he said, turning back to the resident while making sure she could still hear every word, "we can allow the actual doctors to manage the dosing. Family education is valuable. Nurses providing real-time medical opinions to attending physicians, in front of the patient, crosses into something different, doesn't it? Something that concerns me about protocols and professional boundaries." He turned back to the patient's wife, who was watching this exchange with the kind of fear people get when they realize the people keeping their husband alive were arguing. "I assure you everything is under control." Katie stepped back, retreated into the space where nurses lived, the middle ground between the family's terror and the physician's dominion, and watched the resident prepare the injection with the wrong dosing. She said nothing. What she'd learned, what this 8 months had taught her, was that Ashford had allies, 3 of them in this room right now, watching to see if she was the type of nurse who stayed in her lane or the type who needed correcting. The dosing would almost certainly not harm this patient. The margin was small. The risk was low. But it was still wrong, and she would carry that knowing in her chest like a stone. The next morning, Katie found the unit board outside the nurse's station, the kind of whiteboard where shift assignments and patient census numbers usually lived. Today it had something new. An incident report printout, her name in block letters, the violation documented with institutional language that made it sound like she'd done something criminal, unauthorized medical consultation in patient care setting. Protocol violation. Insubordination to attending physician. The note was signed by Dr. Marcus Ashford, dated the previous evening, and copied to the Director of Nursing, the Quality Assurance Committee, and 3 other names she didn't recognize. She read it twice. Her jaw tightened once, on the second read, a small clenching behind her molars that was barely visible. Then she took it down, filed it in the documentation folder where it belonged, and clipped her badge to her pocket, the one she'd reinforced, the one that still held, and moved toward her assigned patients for the shift. The break room at 1322 was where the other nurses gathered when their breaks aligned. It was small, overly bright fluorescent like everywhere else, with a refrigerator that smelled like old tuna and a microwave that had been running the same rotation of reheated coffee for probably 3 years. Katie sat down at the small laminate table, the one near the window, with her lunch in its plastic container. Ham sandwich, carrot sticks, an apple. Simple. Practical. She'd been eating the same lunch for 5 years. The other nurses came in around 1327. There were 5 of them, Sarah from day shift, Marcus who'd worked nights before transitioning to days, Jennifer, Lisa, and one of the newer residents whose name Katie had heard but wasn't certain about. They gathered around the table, and she watched them register her presence the way people do when something uncomfortable is already in the room. Sarah's eyes flicked toward Katie's face, then away. She picked up her lunch bag and said something about needing to eat in her car today, something about the afternoon light. Marcus followed her, and then Jennifer, and then Lisa. Within 40 seconds, Katie was alone at the table with her sandwich and the humming of the refrigerator behind her. She could hear them in the hallway outside, their voices dropping to something that wasn't quite whispers but wasn't quite normal volume either. The tone carried, sympathetic, concerned, carefully neutral in the way people got when someone had been marked as complicated. She finished her sandwich. All of it. Ate the carrot sticks one by one, methodical and complete, and didn't look toward the door or the hallway or anywhere that might suggest she'd noticed. By the time she left the room, she was moving with the kind of calm that came from a particular kind of training, the kind that taught you how to operate when the people around you had decided you didn't belong in the spaces you occupied. The cemetery sat on the eastern side of Houston, where the old stones dated back to the 1800s and the newer ones still gleamed with that fresh granite sheen. Katie found the grave the way she always did, moving through the rows without checking her phone or looking at a map, some part of her holding the coordinates the way soldiers hold waypoints. The stone read James Gabriel Rodriguez, and underneath it the years that mattered, 1984 to 2015. That's all anyone needed to know. No medals mentioned. No unit designation. Just the space between his birth and the day he stopped existing. She knelt in the grass, which was still damp from the morning dew. Her left leg didn't bend the way it used to. The injury had healed, 3 surgeries and 2 years of physical therapy had seen to that, but the range stayed limited, the muscle memory of the IED blast embedded in tissue that would never quite trust extension again. She reached into her pocket and pulled out the dog tag, the single piece of metal on a broken chain that she kept in her locker. Her name wasn't on this one. His was. Or what had been left of identification after the blast. I thought I could build something new here, she whispered to the stone, to the ground beneath it, to the man who lived in the space between those years. A life that wasn't borrowed, that wasn't just waiting for the next extraction. She paused, one breath, and her voice dropped lower. But I'm failing you all over again. The evening light was turning the sky that particular shade of orange it got in late spring, and a wind moved through the cemetery with the sound of rustling leaves and the distant call of a mourning dove. Katie didn't cry, that was a luxury she'd learned to surrender years ago, back when crying attracted attention and attention attracted the wrong kind. Instead she pressed her thumb against the dog tag, feeling the raised letters of the name, and held it there until the metal warmed from her skin. The surgical team assembled like predators circling a feeding ground, and Katie could taste the antiseptic on her tongue as Dr. Ashford lifted the laryngoscope with the casual arrogance of someone who had never been told no. The patient, a 47-year-old male, 3 hours post-op, already losing color, lay prepped for re-intubation, and Katie watched from the corner where she always stood, the space where invisible people belonged. Ashford's hands moved wrong. The blade went in at the wrong angle. The vocal cords disappeared into shadow instead of coming into focus, and Katie counted the seconds silently, 8, 9, 10, which was already too long, already dangerous, already the moment when tissue began dying from hypoxia. The attending stood 3 feet away and said nothing. The residents held their breath. Nobody moved. Katie took 1 step forward. Just 1. Second blade, she said quietly. Smaller diameter. The room froze. Ashford's eyes went flat, then hot. He didn't lower the instrument. Instead he withdrew slowly, deliberately, making sure everyone watched him make his decision, and when he switched blades, his movements became theatrical, exaggerated, theatrical, performed. The intubation succeeded on the second attempt, which meant Katie was right, which meant she had corrected him in front of 8 people, which meant she had violated the only law that mattered in a surgical hierarchy. He didn't look at her. He looked through her, which was worse. Tube is secure, he announced to the room, and then to the team, note that we maintain protocol in this unit. Some people seem to require reminders. His voice carried the weight of institutional authority, and Katie felt the temperature shift as every resident and in turn became suddenly interested in the floor or the monitors or anything except making eye contact with her. When Ashford finally glanced sideways, his expression was a weapon. In fact, I think we should all be very clear about chain of command. When a physician makes a clinical decision, that decision stands. Questions get asked after the patient is stable. In private. Not. He paused, letting the silence fill with implication. Not from people who don't have the credentials to ask them. Katie breathed in slowly through her nose. The fluorescent lights hummed their mechanical song, and she felt the weight of 8 pairs of eyes pretending not to watch her reaction. This was the moment. This was when most people crumbled, when the humiliation turned public, when the institutional power showed its teeth, when you realized you were standing alone in a room full of people. She took 1 measured breath. Held it. Then, I've seen what happens when pride costs more than protocol. I won't watch it happen here. 1 tear traced down her cheek. She didn't cry, not really, not the way civilians cried with shaking shoulders and desperate gasps. Just 1 tear, salt water escaping the architecture of her composure, and she wiped it without breaking eye contact with Ashford. Her hand was completely steady. The silence in that surgical suite became a living thing, thick and pressurized, and Ashford's face darkened to a shade of purple that suggested dangerous blood pressure elevation. He turned his back to her and began his post-operative notes with movements so sharp they bordered on violence. Nobody said another word until the patient rolled toward recovery, and even then, the conversation stayed clipped and professional, devoid of the easy banter that usually marked successful procedures. What happened next was worse than public humiliation. It was systematic. 3 days later, Katie checked the unit's shift board and saw her name in Ashford's careful handwriting: Thanksgiving, Christmas Eve, Christmas Day, New Year's Eve, New Year's Day. Every single holiday in the next 8 weeks. She looked at the other assignments: experienced nurses clustered around the weekends, the senior staff given their preferences, the newer staff scattered across Tuesday shifts when the unit ran light. Just her. Holiday after holiday. Alone. The break room at Seattle General smelled like burnt coffee and desperation, and Katie learned quickly that it had become a sophisticated ecosystem of cruelty. When she arrived at 1:13 p.m. with her container of rice and grilled chicken, the room was occupied by 4 nurses: Margot, Jennifer, Sandra, and Chen, who sat clustered around the corner table like they had claimed it by ancient right. The conversation stopped when she entered. Not immediately. That would have been honest. It took 3 seconds of pretend conversation to die out, 3 seconds of them registering her presence through some sixth sense developed by people who practiced exclusion like it was a surgical technique. Then Margot gathered her things with exaggerated care, and Jennifer said something too quiet to hear, and Sandra laughed in that specific way that meant the joke was about someone who wasn't part of the circle. They relocated to the far side of the break room, carrying their trays and their conversation and their belonging. Katie sat at the abandoned table and opened her container. The vending machine hummed its lonely electric song. The microwave ticked down someone else's lunch. She ate methodically, chewing each bite the exact same number of times, her mind somewhere else, somewhere where people didn't practice exclusion as art form, somewhere where a corrected medication dosage meant you were paying attention and not committing insubordination. By the second week, it wasn't just relocation. It was performance. Katie walked into the break room on a Friday at 1:22 p.m., and the entire dynamics shifted. Margot literally stood and gathered her things before Katie had even sat down. Jennifer made a small noise, something between a sigh and a groan, as if the very air had been contaminated by proximity. Sandra turned her chair away. Chen looked at her food like it had suddenly become interesting, but his jaw had tightened, which meant the pressure was working, which meant Ashford was winning. "Don't mind us," Sandra called over her shoulder as they relocated again, this time with audible satisfaction. "We're just moving to where people actually belong." Katie opened her container. She did not cry. She did not tremble. She did not retreat to a supply closet or collapse into private devastation. She ate rice and grilled chicken while the vending machine hummed, and the part of her that had led field hospitals through sustained fire in Marja recognized exactly what was happening. This was operational. This was a calculated campaign. The pressure increased in calculated increments. Ashford worked the break room like he worked the surgical suite, with institutional authority and the confidence of someone who had never faced real consequences. Katie caught fragments of conversations that stopped when she appeared, sentences that began with her name and concluded with descriptors like "too aggressive" and "it doesn't understand teamwork" and "not really suited for this environment." The whispers came from people she'd helped, people whose patients she'd saved, people who had watched her work and said nothing. By the third week, even Chen stopped making eye contact. The unit board near the staff station held all of Ashford's official power, and Katie learned that documentation could be weaponized like any other instrument. The incident report was pinned where everyone would see it, dated to the surgical suite correction, annotated by Ashford in his careful physician handwriting with phrases like insubordination, protocol violations, and concerning disregard for chain of command. Beneath it, he'd attached her employee file note, formal written warning, filed with hospital administration. She read it once, then walked away without any visible reaction, which required the kind of discipline that most people never develop because most people had never needed it. Her hands didn't shake. Her vision didn't narrow. She simply absorbed the information and continued her shift like the institutional power structures had not just publicly declared her problematic. But that wasn't even the worst part. The worst part was what happened at 2:38 a.m. on a Tuesday when the trauma bay doors exploded open and a man who weighed at least 300 pounds came through covered in blood, screaming for help in the particular terror voice of someone whose body was betraying him in real time, and every trained physician at Seattle General froze like they were models in a museum of modern medicine instead of people whose job was saving lives. The room went silent except for the monitors and the screaming, and Katie felt something shift in her chest, felt the desert heat replace the hospital's climate control, felt the weight of a rifle she hadn't carried in 8 months, felt the muscle memory of a version of herself she had tried very hard to bury. She stood. She walked toward him. And everything changed. The trauma bay doors exploded open at 2:33 a.m. A 300-pound man stumbled through, shirt soaked crimson, eyes wild with the particular terror Katie recognized from field hospitals in Marja, that look of someone whose body was breaking faster than his brain could process. He was screaming. Not words. Sounds. The primal noise of a creature realizing it was dying. The room scattered. A resident backed toward the wall. 2 nurses wheeled their crash cart sideways as if the man might infect them with mortality. Dr. Ashford stood at the far end of the trauma bay, arms crossed, taking mental inventory from a safe distance. Nobody moved toward the patient. Nobody spoke his name or asked his story. The fluorescent lights hummed their mechanical indifference. Katie was already walking. Hands visible. Palms open. Every muscle in her body screaming to run, old muscle memory from Marja that never fully died, but her feet moved toward the bleeding man like she was being pulled by a wire only she could feel. She didn't run. Runners made people panic worse. Runners meant danger was real. She stopped 4 feet away. Close enough to help. Far enough to let him breathe. "I need you to hear my voice," Katie said. Soft. Level. The kind of calm that comes from having already survived worse. "You're safe now. This is Seattle General. We have doctors here." The man's eyes locked on hers. Dilated pupils. Shock beginning to set in. His breathing was fast and shallow, hyperventilation pushing oxygen into his blood but doing nothing to settle his nervous system. His left hand clutched his ribs. "I'm going to walk closer now," Katie continued, voice dropping another half octave. "I'm not going to hurt you. I'm here to help. What's your name?" "Can't," his voice cracked. "Can't breathe right." 90 seconds. That was her window before the adrenaline crash converted to code status. 90 seconds before he went from terrified to unconscious. "My name is Katie," she said, moving 1 step closer. Her hand stayed visible, open. "I've helped people like you before. A long time ago. In a place a lot like this." She paused. "Let that register. Tell me your name." "Marcus." The word came out broken. "Marcus Webb." "Okay, Marcus. Here's what's happening. You have a chest injury. The pain you feel, that's information. That's your body telling us exactly where to look." She was moving now, hands reaching for his jacket. "I need to examine you. Can I touch your chest?" He nodded. "Barely." His breathing was still too fast, 30 breaths a minute, oxygen saturation probably sitting somewhere around 88 if he was lucky. She unzipped his jacket with movements that were precise and practiced, muscle memory taking over. Hands that had dressed field wounds under fire. Hands that had held pressure on sucking chest wounds while mortars fell outside the tent. There. Below the 5th rib. A wound about the size of a quarter, dark and glistening. Air was moving through it with each breath, the sound like wind through a punctured tire. With every inhale, air rushed into the chest cavity instead of the lungs. With every exhale, it whistled out again. Sucking chest wound. Tension pneumothorax building. Katie's mind ran the calculations. Blood loss was slow but steady, oxygen saturation dropping maybe 2 points per minute now. 15 minutes if they did nothing. Less if the tension pneumothorax progressed. "I have something that's going to help," Katie said. "It's going to feel weird, but it's going to work. Trust me." She reached into her medical bag without breaking eye contact with Marcus. The bag she carried everywhere. The one the other nurses made jokes about, Katie's little emergency kit, like she was paranoid or preparing for the apocalypse. They didn't ask questions. They didn't want to know why a trauma nurse from Houston kept specific items buried in the bottom of her personal medical bag. Her fingers found the MRE package. Meal ready to eat. Flameless ration heater from a supply she'd kept since discharge, buried under extra gauze and field dressings and things that belonged to a life she wasn't supposed to be living anymore. The plastic was sealed. The backing was foil. Military issue. Simple. Effective. This is going to seal the wound, Katie said, tearing the foil backing away. When I put it on, you're going to feel pressure, then relief. The whistling will stop. Your breathing will get better. The fear won't go away, but your body will know it has a chance. She pressed the foil side of the MRE package directly over the sucking wound. 3-inch seal. Completely occlusive. The whistling stopped. The hissing of air escaped once more, then nothing. Just the sound of a man's breathing beginning to normalize, beginning to believe he wasn't going to die. There, Katie said softly. That's triage protocol. Field dressing under pressure. The words had slipped out, for military terminology, field terminology, the kind of language that belonged to someone who'd worked in a place that required a different vocabulary than Houston General had ever needed. She taped the edges down with surgical tape she pulled from her pocket, another relic, another piece of equipment carried by someone who'd once known how to function in chaos. The tape held. The seal held. She was already calling out numbers to the residents who were finally moving, finally remembering they were doctors. Oxygen mask now. 14 liters non-rebreather. Get 2 units of O-negative type and cross. For access, second attempt is mine if the first line blows. She was already prepping the site on his left forearm, alcohol wipe, 18-gauge angiocath, the needle sliding in with the kind of precision that came from having done this 10,000 times, not 500 times. BP cuff. Continuous pulse ox. I need real-time numbers. Dr. Ashford had moved closer, but not to help. He stood at the edge of the trauma bay, watching. Watching Katie work. Watching her hands move on their own. Watching the way her voice had shifted down an octave and carried weight it hadn't carried before. Watching the way everyone else deferred to her now, following her orders like she'd just conducted a symphony and they were finally playing the right notes. The oxygen mask went on Marcus Webb's face. The mask that had been made in a military factory, designed for soldiers who needed it in places where there wasn't time for aesthetics, only function. Oxygen saturation numbers climbed on the monitor. 75, her hands moved to prepare the chest seal edges for long-term stability. 82, the force slid in clean on the first try, blood flowing back into the catheter, confirmation of placement. 88, she was already talking to the trauma surgeon, giving him information he needed, mechanism of injury, time of presentation, current vitals, the exact location of the wound and the exact method of initial management. 92, stable. The room had gone quiet except for the beep of the monitor and the hiss of the oxygen flowing through the mask and the quiet professional voice of Katie Rodriguez rattling off numbers like someone who'd done this 10,000 times in 10,000 different versions of chaos, and nobody was asking questions yet, but they were noticing. The residents were noticing. The nurses who'd scattered were noticing the way her hands moved with absolute certainty. The way she'd known exactly what to do with an improvised seal made of military-issue rations. The way her language had shifted to something older, something operational, something that didn't belong to a trauma nurse with 8 months of hospital experience. Nobody had asked her where she learned to do that. Not yet. Dr. Ashford was making mental notes. Not notes about the patient. Notes about Katie. Notes about the way she'd just revealed something she shouldn't have revealed. Notes about the way she'd just given him exactly what he needed to destroy her. The doors hadn't even fully closed behind the stretcher when Dr. Ashford moved. Katie saw it in the way his jaw tightened, the way his eyes narrowed as he watched the trauma team wheel the 300-pound man towards CT imaging. He wasn't thinking about the patient anymore. He was thinking about her. About what she'd just revealed. About the terminology she'd used. About the way her hands had moved with the precision of someone who'd done this before. Many times before. in places that didn't have ventilators and surgical lights and sterile fields. By 3:14 a.m., Ashford had already dictated a formal incident report into the hospital database. Unauthorized medical intervention utilizing non-approved materials. Breach of chain of custody protocols. Suspicious field medical equipment maintained in personal possession. Potential safety risk requiring immediate investigation. The language was careful. Bureaucratic. Institutional. It didn't say what it really meant. I saw something. I don't know what it is. But I'm going to destroy her for it. Katie was sitting in the break room at 3:27 a.m., holding a cold cup of coffee she wasn't drinking, when her phone buzzed. A message from her direct supervisor, nurse manager Patricia Chen. Dr. Ashford has requested a formal meeting. Tomorrow, 0800. Bring all materials from Trauma Bay 3. Katie stared at the message. Materials. He meant the MRE package. The improvised seal. The evidence. She'd already wrapped it in a biohazard bag, documented the patient outcome, filed the equipment per protocol. She had nothing to hide. Except everything. She set the phone down and didn't respond. What happened at 4:06 a.m. was worse than any meeting. Ashford called the hospital's chief medical officer directly. Katie didn't know this yet. She wouldn't know it for another hour when Patricia Chen pulled her aside in the hallway, her face carefully neutral, and said, "The CMO wants to audit your personnel file. All of it. And Dr. Ashford is leading the review." Not asking. Informing. Katie nodded once and kept walking. Her heart wasn't racing. Her hands weren't shaking. The trembling wasn't fear. It was restraint. The kind of restraint that comes from knowing exactly what Ashford was doing and being unable to stop it because the system he was using was designed to protect him, not her. By 6:22 a.m., Ashford had made 17 phone calls. Not to doctors. Not to other trauma surgeons. To board members. To hospital administrators. To people with offices on the executive floor who made decisions about employment. Katie didn't know the content of those calls, but she could imagine it. Concerning background. Suspicious materials. Questions about training and certification. Potential security risk. Never a direct accusation. Never anything that could be documented as a lie. Just seeds planted in the minds of people who controlled her career. At 6:51 a.m., the reassignments went live. The 3 nurses who had been in the trauma bay, Sarah, Jennifer, and Marcus, all received schedule changes effective immediately. Sarah was moved to the pediatric wing, 3rd shift. Jennifer got transferred to the recovery ward, nights only. Marcus, the orderly who had helped Katie stabilize the bleeding, was reassigned to the basement morgue and supply rotation. No explanation. No discussion. Just administrative adjustments. Ashford hadn't fired them. He didn't need to. He'd simply removed them from his field of vision. From any position where they might corroborate Katie's version of events. By 7:15 a.m., Ashford had rewritten the incident report 3 times. The first draft mentioned successful intervention and positive outcome. By the 3rd revision, those phrases had vanished. What remained was a document that read like an indictment: nursing staff utilized unauthorized field medicine techniques without physician oversight. Patient outcome positive, however protocol violations cannot be overlooked. Recommend immediate suspension pending investigation. The tone was sympathetic. Concerned. Like he was trying to protect the hospital from a dangerous employee who might not even realize the rules she was breaking. Katie sat in the locker room before her shift ended, pulling on her jacket. A new nurse, someone from the day shift she'd never spoken to, glanced at her, then deliberately looked away. The message had already spread through the hospital like an infection. Katie Rodriguez was under investigation. Katie Rodriguez had done something wrong. Maybe something criminal. The details didn't matter. The suspicion was enough. People were already choosing which side to stand on. None of them chose hers. The meeting happened in Patricia Chen's office at 0800 sharp. Ashford was there, along with two people Katie didn't recognize from the hospital's legal and compliance department. They had documents spread across the desk. Personnel files. Her training records. The MRE package in its sealed evidence bag. They asked her questions in measured voices about her medical background, her training, her qualifications, the nature of the equipment she maintained. Katie answered each one with the minimum number of words required. Yes. No. Standard field medicine protocol. They didn't ask her directly about her military service. They didn't need to. The implication was carved into every question. Where had she learned to do this? Why did she know how? Who was she? By 09:27 a.m., Katie's access card had been reprogrammed. She could no longer enter the trauma bay. She could no longer access the intensive care unit. She was reassigned to the triage desk in the emergency department, the lowest status position on the nursing staff, the place where new graduates worked while they proved themselves. It wasn't a demotion written in the system. It was an administrative adjustment. A precautionary measure. A way to contain the problem while the investigation continued. Ashford entered the break room at 11:04 a.m. when he knew Katie would be there during her scheduled break. He sat down across from her with a sympathetic expression. "I want you to know I'm not enjoying this," he said. His voice was reasonable. Almost kind. "But we have a responsibility to the hospital. To the other staff. You understand?" Katie didn't respond. She didn't look at him. She finished her sandwich and threw away the wrapper. "I'm sure there's a reasonable explanation," Ashford continued. "Your background. Your training. How you came to be equipped with that specific field medicine kit. I'm sure it's all perfectly innocent." Katie stood. "The investigation is confidential," Ashford said as she moved toward the door. "You shouldn't discuss it with anyone. Not the other nurses. Not the board. Not anyone." It wasn't a request. It was a command. She left the hospital at 1430 hours and drove to Grandview Cemetery on the west side of Houston, where the rain was just beginning to fall. It came down in sheets, cold and relentless, hammering the pavement and the grass and the headstones. She knelt at the grave marked Marcus James Rodriguez, beloved husband, 1988 to 2014, and the rain soaked through her jeans. Her hands weren't shaking. Her breathing was controlled. But her eyes burned. The kind of burning that comes from holding back something that needs to break. "I thought I could build something new here," she whispered to the headstone. The rain came harder, as if the sky itself was trying to silence her. "I thought I could just be a nurse. Just be normal. Just be Katie instead of Major. But I'm failing you. I'm failing everyone. Just like I always do." She pressed her forehead against the wet stone and stayed there for 6 minutes, not moving, not crying, just breathing the cold air and tasting copper and rain. When she finally stood, her knees were soaked and her jacket was plastered to her ribs. She pulled out her phone and checked her messages. 17 notifications. Hospital policy emails. A text from Patricia Chen, "We're placing you on administrative leave effective immediately. Please turn in your badge tomorrow morning." Not a conversation. Not a meeting. An email. The kind of thing you send to someone you're erasing from your institution. She was walking toward her car when she heard it. Distant at first. The sound of helicopter rotors cutting through the rain, getting closer. Not an air ambulance. The rhythm was wrong. Military. Katie stopped walking. She didn't know why. She just stopped and looked up at the gray sky, at the direction the sound was coming from. The rotor wash was getting louder. Getting closer. Getting impossibly close to a cemetery on the west side of Houston where a nurse in soaked clothes stood alone in the rain, holding a phone in one hand and a broken dog tag in the other. And then everything else would change. But Katie didn't know that yet. 3 days later, at 6:22 a.m., Katie checked vitals on the 300-pound patient in ICU bed 4. His eyes opened. They locked on hers. He didn't blink. His lips moved. One word escaped, barely audible: Reaper. The monitor beeped once. Her hands didn't falter. She wrote down his oxygen saturation, 94%, stable, and stepped back, her face revealing nothing. But something inside her had shifted. He knew. Somehow, impossibly, he knew who she was. That afternoon, his grown son arrived carrying flowers and a paper bag from the hospital cafeteria. He walked past the nurse's station, entered the room, set the flowers on the windowsill. Then he turned and saw Katie hanging a fresh fur bag. He stopped. His eyes narrowed. He stood very still. "Wait," he said. "You're Major Rodriguez." Katie's hands continued their work. Tubing secured. Drip rate checked. She didn't turn. When she spoke, her voice came level as a horizon. "Your father rested well?" "No." The son stepped forward. "You commanded Marja." The room went silent. The ventilator wheezed its mechanical rhythm. Katie clipped the 4 line and finally turned to face him. In his eyes was the unmistakable recognition of someone whose life had depended on her decisions. "I'm a nurse now," she said. Nothing more. He didn't argue. He sat in the visitor's chair and picked up his father's hand, tears already streaming, and said nothing at all. Within the hour, a trembling ICU nurse named Jessica, fresh out of orientation, 19 years old, hand shaking as she pulled the patient's military records from the system, walked up to Katie at the medication dispensary. Her voice cracked. "I found something," Jessica whispered. "In his emergency contact file. I thought you should know." Katie took the printout without looking at it first. Jessica read it aloud, each word spoken through barely controlled emotion. Patient's emergency contact listed as Major Catherine and Rodriguez. Former commanding officer, 160th Special Operations Aviation Regiment. 2 silver stars. Purple Heart. Medical discharge status, full honors. Service record, sealed. Clearance level, compartmentalized. The paper didn't move in Katie's hands. "There's more," Jessica said. The system flagged a notation. "It says here you authorized his field evacuation during the Marja campaign. It says you made the call that saved his life." Katie folded the paper once. Twice. She handed it back to Jessica without speaking and walked toward the stairwell, her pace exactly normal, her face a geography of control. The next voice Katie heard came from the hallway outside the ICU. A man's voice. Authoritative. A voice that carried the weight of decisions made at 30,000 feet. Lieutenant Colonel James Graves stepped into the ICU corridor in dress blues. His posture was the kind you learned through 17 years of leadership. His presence made the air pressure change. Every nurse and resident within 30 feet stopped moving. He walked directly to where Dr. Ashford stood reviewing charts near the nurse's station. "Dr. Ashford." Graves extended his credentials, JSOC Task Force, Embedded Army Medical Command Liaison. "I'm here to check on one of your patients. Ranger First Class Michael Chen." Ashford's face had already begun its shift toward hospital politeness. "Of course, Colonel. He's recovering excellently. Our trauma team performed." "Your trauma team?" Graves gestured with a single finger toward Katie, who had just emerged from the stairwell. "That one. The one you have on administrative leave." The hallway froze. Graves turned to face the assembled staff, 2 residents, 4 nurses, the shift supervisor, the nursing director, and Dr. Ashford, and spoke in the flat declarative tone of someone reading a field report. Major Catherine Rodriguez held the field hospital in Marja for 16 hours under sustained fire. Taliban. 3 separate coordinated assaults. She triaged 74 casualties. she performed 17 emergency procedures with equipment you could fit in a rucksack. 47 Rangers came home because of her decisions, including Ranger First Class Chen. The silence was so thick you could operate in it. Graves turned to face Katie directly. The medical community doesn't know who you are, Major. I'm telling them now. He paused. You're needed back in that bay. It wasn't a request. It was a command. Dr. Ashford's face had gone the color of old concrete. Katie didn't smile. She didn't nod. She simply walked past him toward the ICU, and every doctor in that corridor moved aside. But Ashford wasn't finished. Not even close. Within 4 hours, he had locked himself in his office and made a phone call to the hospital administrator. His voice came through the speakerphone high and strained. This is institutional fraud. That woman produced unauthorized equipment during a medical emergency. She never submitted paperwork for that MRE package she used as a chest seal. That's a protocol violation that could expose this hospital to liability. I have the incident report documented. I have witnesses. The administrator listened and said nothing. Ashford kept talking. And now this army officer is here making accusations? This is a coordinated attack on my professional reputation. I demand that woman be removed from this facility immediately before she causes a malpractice lawsuit that costs this hospital millions. Dr. Ashford, the administrator said quietly, I'm going to put you on hold. Don't hang up. 30 minutes later, 3 men in dark suits entered Seattle General's administrative office. FBI badges. 2 of them were already wearing latex gloves. They carried sealed documents and a laptop with a federal seal on the back. They didn't ask for Katie. They asked for Dr. Ashford's files. His patient records. His prescription histories. His billing documentation for the past 3 years. What they found made the administrator's skin go pale. Altered patient records. 17 of them. Insurance fraud totaling $860,000. Concealed malpractice settlements, 3 cases he'd paid families to keep quiet. 1 case involving a patient death where Ashford had documented the wrong cause of death to avoid liability review. His own investigation into Katie had triggered a broader institutional audit. His weapon had cut his own throat. Dr. Ashford walked into that administrative office at 4:51 p.m. and saw the federal agents, the sealed files, the laptop with his billing records displayed in high definition. His knees buckled. He caught himself against the door frame. I want my lawyer, he whispered. The FBI agent closest to him, a woman with gray eyes and a voice like a tank idling, simply said, Your lawyer is going to want to negotiate, doctor. I'd suggest you sit down. He didn't sit. He ran. He ran past the nurse's station where Katie was standing with a patient chart, ran past the ICU where the 300-pound man lay recovering, ran toward the parking garage and his car with the FBI 3 steps behind him. They caught him at the security gate. The handcuffs clicked with the specific metallic finality that comes from federal custody. An agent read him his rights while another held his elbow. His mouth moved but no sound came out. Nurses lined the corridor in absolute silence as they walked him past, and every single one of them was watching. 6 months later, Katie pushed through the night security entrance at 11:13 p.m. for her shift. The security desk was staffed by someone new. Someone who looked vaguely familiar in the way that broken things sometimes do. It was Dr. Marcus Ashford. His name tag read, Steve. His ill-fitting uniform hung loose across his frame, he'd lost weight. His eyes dropped to his shoes when she passed. Katie didn't slow down. She didn't acknowledge him. She walked directly to the locker room, opened her locker, and took out the dog tag on its broken chain. For the first time since she'd started at Seattle General, she placed it around her neck. The metal was cold. It rested against her sternum, visible above her scrub line, impossible to miss. She buttoned her jacket. The dog tag stayed visible. In the trauma bay, the staff saw it and understood. Over the next weeks, Katie began teaching, not lectures, but clinical mentorship. She worked alongside the younger trauma nurses, showing them the same field medicine principles that had kept soldiers alive in Marja. She taught evidence-based protocol over hierarchy. She taught that a junior nurse's correct observation mattered more than a senior doctor's convenience. She taught that speaking up saved lives. The hospital's culture shifted. Not all at once, but measurably. The board hired a new trauma director. They established a mandatory ethics review for all senior physicians. They created a safe reporting system where staff could flag concerns without retaliation. They added a dedicated veterans care wing, pro bono services for any former military personnel who came through their doors. Katie was offered the position of Chief of Trauma Services. She declined. "I'm staying in the Bay," she told the administrator. "My fight is with the patients, not the paperwork." 3 days later, a young nurse, couldn't have been more than 23, approached Katie during a quiet moment in the ICU hallway. The new girl, Angela, who transferred from another hospital after hearing Katie worked here. "Is it true?" Angela asked. "What they say about you?" Katie was checking a patient's oxygen tubing. She didn't look up. "What do they say?" "That you saved 47 people. In a combat zone. That you commanded an entire operation." Katie finished checking the tubing and turned to face Angela. "I followed protocol. I made decisions based on data, not ego. Those Rangers survived because they were trained, because they had good leadership above me, and because they refused to quit." She paused. "And because I was too stubborn to accept that death was inevitable." Angela nodded slowly. "I want to be like that." Katie placed a hand on her shoulder, the first physical contact she'd initiated with a peer in months, and said simply, "Then speak up when you see wrong. Every single time. Even when it costs you." That evening, Katie drove to the cemetery. Not to kneel this time. To stand. She stood at her husband's grave with her hands in her pockets, the dog tag visible in the dying light. The rain came, but she didn't turn her collar up. She let it fall on her hair, her shoulders, the metal at her throat. "I'm done running," she said to the stone. "I'm done hiding. And I'm going to make sure that what happened to you, what happened because the wrong people were in charge, never happens on my watch again." The rain drummed against the cemetery like applause. She didn't cry. She didn't tremble. The trembling wasn't fear. It was restraint. It was the weight of every decision she'd made and every life that had hung in the balance, finally being allowed to settle into something like purpose. Back at Seattle General, in the security office, Dr. Marcus Ashford mopped the trauma bay floor. His hands moved in mechanical circles across tile that he used to command. He flinched when anyone walked past. The other security guards didn't speak to him. The nurses didn't acknowledge him. One of them, Jessica, the trembling girl from the ICU, was now Katie's primary mentee. Jessica carried a notebook where Katie had written protocols and decision trees. Jessica asked questions. Jessica spoke up. The hospital was changing. Not from management directives or policy updates, but from the ground up, from the trauma bay outward, from a single nurse who'd refused to accept the hierarchy of silence. Katie pulled vitals on a new patient, a young man with a knife wound to the abdomen, and found herself moving with the precision of someone who'd spent years making split-second decisions under pressure. Her hands were steady. Her voice was clear. Her mind held no doubt. The patient's eyes opened. "Are you a doctor?" "No," Katie said. "I'm a nurse. And I'm going to keep you alive." She didn't say anything else. She didn't need to. Sometimes the bravest warriors carry stethoscopes, not guns. If you ever feel like you're too good for your position, or too broken for your comeback, ask yourself this: what if the person you're dismissing as just a nurse is holding more weight in their hands than you've ever imagined? What would you do differently? Hit subscribe. Turn on notifications. And share your story in the comments.